Utilizzando il cosiddetto allenamento immunitario che prevede l'impiego di farmaci specifici, è possibile ridurre il numero e la gravità delle infezioni respiratorie ricorrenti dell'età pediatrica? Ebbene, l'abbiamo chiesto a un vero esperto, al professor Manuel Soto-Martinez, che abbiamo incontrato qui a Milano al Congresso Europeo di Malattie Respiratorie, l'ERS. Professor Soto-Martinez, first of all, which is the importance of immune training inducer to contrast wheezing, the problem of wheezing, and how they works?
Okay, so first of all, we have to know that respiratory tract infections are the main cause of this recurrent wheezing in children. So children, particularly younger children, we were mentioning between 3 and 5 years of age, below that, are at increased risk of these respiratory tract infections because they have a immature immune response, and that will give them the risk of having these recurrent respiratory tract infections. So if we aim to train to enhance this immunity response, then these children might have less respiratory tract infections and thereby will have less wheezing episodes, and the whole burden that comes with it will be decreased. Now, how does these immune modulators act? So particularly with bacterial lysates, what the studies have shown is that by stimulating the gut immune system, there is a response on the immune system within the lungs. And therefore, these children might have less infections, less severe infections, less duration of these infections, and better outcomes. So there are several studies in the literature, particularly there's been 3 studies, the RASI study and following other studies that have shown that if you have these preschool children that are at increased risk of having recurrent episodes, when you give these OM-85 or bacterial lysates, these patients have nearly 40% of less respiratory wheezing episodes, less infections, and less duration of these episodes. So I think that is an encouraging time for us as pediatric pulmonologists looking at patients with bacterial lysates and this immune training. There are some coming studies that will give us even more information, but it's very exciting times.